My name is Dr. Brad Fideler. I'm an orthopedic surgeon. I practice here in Lake Geneva at Mercyhealth Medical Center. I've been an orthopedic surgeon here for just about 25 years. Obviously with the pandemic, things were emergency only for probably about 4 or 5 weeks. A few weeks ago, we actually started doing some outpatient elective surgeries just to keep people out of the hospital. As of last week, we actually started resuming doing normal orthopedic procedures and inpatient procedures like joint replacements. Arthritis is a disease of a joint, and one of the kind of misunderstandings about arthritis is really what it is. And the lining of all of our joints is covered with a layer of cartilage. It's kind of like the tread on a tire. And that cartilage has a limited lifespan. There's a thickness to that cartilage that over time and after injury and certain other ailments, that layer of cartilage will actually wear away. When that layer of cartilage wears away, the bone becomes exposed, and that's what causes pain. So once the cartilage is gone, that layer of covering on the bone, that is what really causes the pain, because those patients are walking. Everybody's heard the term bone on bone. So when that layer of cartilage is gone, they're actually rubbing on the bone, which is what causes the pain. Fortunately, over the years of what we've been able to do with arthritis, we have a joint replacement procedure which is capable of resurfacing the arthritic problem. People have a little bit of a misconception too of what a joint replacement is. It's not like we go in and take out the entire joint and everything in there. It's basically a resurfacing procedure. And I have some models that I'll actually explain that to you. This is also a model that I'm not sure how well the camera can see, but this is kind of a depiction of what arthritis really is. And there's different stages of what arthritis is. It's from mild to moderate to severe, because over time the layer of cartilage wears away thinner and thinner and thinner to the point where it's completely gone. And this is kind of depicting that, where you have normal cartilage, which is just basically the lining of the joint is normal and there's no damage to the cartilage at all. And then these are different stages as the arthritis gets progressively worse to the point where there's really no cartilage left at all. When a patient is having significantly debilitating pain, where they really are affected with what they want to be doing and can't be doing, whether it's recreationally or occupationally, that's usually what brings them into the office. And it doesn't mean that you have to have a knee replacement immediately. There's some things out there that we can do to also try to help with some of the pain. Cortisone injections, gel injections, things that we can kind of help people delay the procedure. You kind of want to use a joint replacement operation as kind of the last straw, so to speak. What that entails too is it's not really a joint replacement, it's basically a joint resurfacing. And I have some models here that I'll explain that to you. The surgery itself is very straightforward. It's about a 45-minute procedure. The nice thing about knee joint replacements is that there's no restrictions on you at all. Once you've had it done, you can stand and walk on it right away. Depending on the patient, you stay either 1 night or 2 nights in the hospital. Physical therapy starts immediately the day of the procedure, so they actually get that patient up and stand and walk them the day of the procedure. And so the results are very good. People are extremely happy once they've had it done. The procedure involves really making a little incision on the front of the knee. And this is a model. I'll show you the total knee first, and then I'll show you the partial knee, which is... So basically what we do with a knee replacement is you make a little incision over the front of the knee. This is actually a model of a knee joint. And then with some special instruments, we just shave off the arthritic part of the knee itself. So with the instrument, we actually shave off the arthritis. This is a little metal cap that goes over the bone in your thigh called the femur. And then the bone on the lower leg called the tibia, we shave off the arthritic part there. Again, just little shavings. It's not like we're cutting big pieces of bone off. We're just removing the arthritis. And then this is a little metal plate that goes on the tibia. And there's actually plastic that snaps onto this metal plate. And then this becomes your new knee joint. All right, so now instead of standing and walking bone on bone, you're actually walking metal on plastic, so you don't have pain anymore. Now, it does require some physical therapy after the procedure itself. People are in therapy from 4 to 6 weeks, depending on how quickly their motion and their strength comes back. But then they're actually able to get back to doing what they want to be doing, whether it's walking or biking or anything that they could feel comfortable doing. It's a really good operation. It's really great at getting people back to doing what they want to be doing. If you're a younger patient and you have arthritis in just one single compartment, this is really a joint replacement for people who have arthritis in the entire knee. If you have just one compartment that's involved, then there's an operation where we can actually do just a partial knee replacement, which is a smaller operation, involves less surgery and quicker recovery. And that's what this model is depicting. So this is basically the same type of procedure where we're resurfacing the knee, but we're just doing on a partial basis. So this is called a uni-compartment or a partial knee replacement. And those are just two models that we have in the office that I brought in. Well, obviously we'd like to get people as old as we can. The lifespan of the knees that we're putting in now is probably 20 to 25 years. So obviously we want one knee to be the one that lasts them as long as we can and hopefully forever. The problem with younger patients in doing knee replacements is there's a high likelihood that knee will become loose and need to be revised. So we want them to be as old as we can get them. Now obviously there's younger patients that have had injuries or trauma or some problem where the knee joint deteriorates. There's no real set age limit. It really depends on the severity of the arthritic situation and how much it affects what you want to be doing. If you're a 45-year-old person and you have a knee that's completely shot and your life is really miserable and you can't exercise and you can't work and you can't stand, well then obviously that's a patient that a knee joint replacement would be helpful for. So it's not like we can't do it in somebody who's younger. It's just that they need to be aware of the fact that there's a chance that in their lifespan that knee joint may loosen and they might need to have it redone. So there's no set age limit. It's really taking a case-by-case basis and kind of formulating a plan to help those patients. We actually are seeing patients in the office now. For a period of time we were just doing telemedicine visits, but now we're actually have clinics that are open. We've altered things a little bit where we spread things out in the clinic so there's not people sitting in the waiting room around other people. So we've really kind of spread things out in the office. But there's definitely clinic space open. We are doing elective surgeries now. We're doing joint replacements, and so we're open for business.